you wanted to bring some humanity back to this. So tell me what you want to show me.
Yeah, so this here, to Alberta Health Services, Kathy Harness is just one midwife working in Alberta who decided to stand by her convictions rather than coercion. Doesn't mean much to them. But if you look at this here, this is Kathy Harness's shoes. And a lady came by and she dropped one rose for every member of her family that Kathy had personally delivered. My little sister was delivered by Kathy. One of the ladies who helped us pack shoes yesterday, she was delivered by Kathy and someone else's little brother. I know of a lady who knows 60 babies that Kathy delivered. The loss to our province of a midwife of 29 years is unspeakable. It's not just a number. It's a person, it's a family, it's a whole community.
Sheila Gunn Reid for Rebel News, and I'm here at the Alberta legislature with Kate King. And Kate, you have behind me, it looks like hundreds of pairs of shoes. Tell us what they represent.
So this is part of the Alberta Boot Project, which is I don't know if you can call it an organization. It's a group of friends and employees that's formed over the last week. Basically, we asked people to send in, if they were put on LOA because of the Alberta Health Services mandate and they're a health services worker, we asked them to send a pair of shoes and a single piece of paper saying what their job description was and how many years of service they had. So yeah, you're not wrong that it's hundreds of pairs of shoes. We've counted them up. We're over 750 pairs right now, representing 11,682 years of service.
And that isn't even half of the care workers and healthcare workers that were put on leave without pay, which is constructive dismissal. I think we're approaching 1,700 in the province of Alberta.
I wouldn't be surprised if it's significantly more than that. The stats that are being released by Alberta Health Services are not those who've been put on LOA. It's those who refused individual testing. The actual numbers are much higher, possibly as high as 10,000. We're actually we have a statistical analysis being done. It's Health Professionals United has created a survey which we've sent out to as many healthcare professionals as we can to try and create an actual statistical data bank of how many people it is. I wouldn't be surprised if this is 10% of the province.
I wouldn't either. Now, we're at the legislature. I have heard that some politicians and people in government have kind of been coming and going. Did anybody come and stop and talk to you?
No one's talked to me yet. I think someone talked to someone else here. We've invited people to invite their MLAs out. I haven't seen any MLAs yet, but the Speaker of the House did come out and he took some pictures, so that's really encouraging. He seemed very moved by the display.
Yeah, Nathan Cooper's a pretty good guy, at least in my experience.
He seems to be.
Yeah. Now, I was here taking some pictures of some of the shoes, and some people have attached their names and their stories, and some people are anonymous, but it's all very moving, and just so many decades of service for some people that they're willing to walk away. Some people 3-4 years or 4 decades of service.
The highest one I've seen is 57. And that, what I find even sadder is the people who just finished their training a year ago and now they've been taken off, because that's, if you've been doing this for 40 years, you've had your career, you've been able to really serve your community. At 1 year in, you have all this unrealized potential. You want to help, but you haven't been able to.
Yeah, and there's, I saw a sign behind me there that somebody's still paying off their student loan, and they've been basically fired through no fault of their own. They haven't really done anything wrong. They just want to, for a lot of these people, maintain their medical privacy.
Absolutely.
It's not even about the vaccine. It's about their medical privacy.
None of this is about the vaccine. When it comes to the vaccine, people have their different medical, religious, whatever reasons for refusing it. But what this comes down to is, do we have the right to say no to a medical procedure we're not comfortable with? And is it fair for us to be threatened financially, socially, and so many other ways for resisting that? Yeah. I don't care what someone's reason is for resisting a vaccine. No matter who you are, no matter what procedure is being forced on you, you should have the right to say no.
Now, I should have asked you this right off the top. What is your tie to this? Why are you involved?
Well, I kind of started it. I'm a primary care paramedic. I have been for 10 years. And as of this week, I'm now unemployed. And it's a result of me not taking the vaccine now. And so I contacted my employer and said, hey, I'm still good, right? My exemption still stands. And he said, sorry, nope. You don't comply, you no longer have a job. So I'm one of these boots. I'm that one right there.
Oh, that's, it's just terrible. That doesn't make any sense, right? You got the exemption on the same grounds for other vaccines, but just not this one. Why do you think they're doing that?
That's a great question. I don't know. I don't try and get into the why too much because I think I'd never come out of that hole.
Yeah.
But I just try and focus on where we can go from here and what we can fight for and how we can appeal to them to change the mandate, because it is our province at risk right now.
Yeah.
We've just lost this many people from a system that was already extremely broken. I don't know if you heard, but yesterday we lost one of our own paramedics and there was no ambulance available to respond for an hour.
Yeah.
Like, we're already seeing the system fall apart. It's been strained for decades, but we're at a breaking point now, and we can't lose people. Like, if this is about safety, we need to hire these people back. You can't point to a single case of practitioner to patient transmission in the last 2 years.
Yeah.
Are we really that much of a risk where it's safer to fire us all than it is to have us work with PPE, with we're following disease prevention protocols. No one's in danger because of us.
That was one of the things that I was talking to Tim Moen about.
Yes.
And he's the one who told me that you were here today. And
Tim's a great guy.
He's a great guy. And actually, Tim and a group of his colleagues in firefighting are being helped through the Democracy Fund. They're challenging the firing, and that's happening all at no cost to them. The Democracy Fund is
amazing.
Thank you. The Democracy Fund is a registered Canadian charity that's covering off all of their legal fees. Mm-hmm. But, rationed care is a symptom of the system that we have. So what does it mean for frontline care if we can just, according to the government, 1,700 people are just kicked out the door?
It's a lot more than 1,700, let me tell you. What it means for frontline care is that we can't do surgeries. Ambulances cannot staff towns. One of the towns that I work in basically didn't have an ambulance all summer. And that's not because of the mandate, that's because of employees on stress leave. Like, the numbers on stress leave are unbelievable. And the more that go on stress leave, the harder the job for those who are left. It means not having ambulances to respond, not having physicians. Some of the towns that I work in as a paramedic right now, we don't have physicians on Tuesdays and Thursdays. If you have a medical emergency, sorry, you got to drive an hour away. Yeah. And we're seeing that happen all over the province. Our system is crumbling and we need help.
Well, and I think, too, these mandates sort of disregard the fact that as frontline workers, you already take precautions in disease prevention and transmission, right?
Yeah, at the beginning of every shift, we take our temperature, we sign in, we fill out a screening tool, which, if you've had any COVID exposures, anything like that, you're not eligible to work. Anytime that we're caring for patients, we're wearing masks, we're wearing goggles. If it's someone who even has a sniffle, we're wearing gowns, we're N95s, the whole 9 yards. We are going above and beyond to preserve proper disease prevention techniques. And this is being disregarded. I mean, as you know, the last 2 years that we've worked the pandemic, it's been good enough, but now only compliance is good enough. And it's a one-size-fits-all solution. The vaccine is not the answer. It's a tool. Yeah. And there's a lot of other treatments and tools, but our hyper-focus on this one area, I think, has made us focus less on the other areas where we could be really bolstering our COVID response.
Now, I promised you this interview would be short when I started talking to you because it's minus 20. It's so cold. We're standing in the shadow of the legislature too, so it blocks out all of the sun. But what's next? Are you taking this around? And if you are, how do people find out?
Okay, so we have a Facebook page. It's 5 days old. But it has thousands of followers now. Yeah. So if you follow the Facebook page, Alberta Boot Project, you can find out about the tour schedule. We're still putting it together. Mm-hmm. So we're in Edmonton today. We have to take down at the end of tonight, which is going to be a big undertaking. Hopefully Calgary and or Red Deer this week. And then most of the other bookings will be in the new year. But we're working on that right now. All the updates will be on the Facebook page.
And if somebody is a frontline worker who wants to add their boots to the project.
Yeah, please come. We actually have had several people come today, bring their boots or shoes, add them to the list. We just say, please bring with them a paper saying your job title, your years of service, and we will catalog it. We've got a big Excel spreadsheet going, and we want to keep track of every single person because every pair matters. Every person matters.
You wanted to bring some humanity back to this, so tell me what you want to show me.
Yeah, so this here, to Alberta Health Services, Kathy Harness is just one midwife working in Alberta who decided to stand by her convictions rather than coercion. Doesn't mean much to them. But if you look at this here, this is Kathy Harness's shoes. And a lady came by and she dropped one rose for every member of her family that Kathy had personally delivered. My little sister was delivered by Kathy. One of the ladies who helped us pack shoes yesterday, she was delivered by Kathy and someone else's little brother. I know of a lady who knows 60 babies that Kathy delivered. The loss to our province of a midwife of 29 years is unspeakable. It's not just a number. It's a person, it's a family, it's a whole community.
This lady has had a hand in bringing generations of Alberta into the world.
Yeah. Yeah.
And she's just gone, thrown out.
Safely, compassionately, kindly. She's not just a machine. She's an incredible lady. I've met her myself. She leaves a difference. Like, she leaves an impact on everybody who she meets. So, yeah, that's just an example. And I'm sure that could be said of hundreds of shoes here. So, yeah, I just wanted to show you that.
Well, Kate, I want to thank you for doing this work and
Absolutely.
and making this a tangible display. Each one of these is not just a person with years of experience, but it's a family behind each
family.
pair of these shoes, and you're making it something that the politicians can't ignore. So thank you for that.
We're trying to bring the humanity back into the discussion.
For Rebel News here at the Alberta Legislature, I'm Sheila Gunn Reid. The Democracy Fund is launching several strategic lawsuits in jurisdictions all across the country in an effort to overturn these forced vaccine workplace mandates, including helping a group of Alberta firefighters and paramedics. Now, these firefighters and paramedics, they are up against the entire government and all the resources that comes with it. But they have you and your donations and your support. If you'd like to help them in their legal challenge, please visit fightvaccinepassports.com. And through that partnership with the Democracy Fund, all donations there now qualify for a charitable tax receipt.